welcome to the Frisco podcast. I'm your host, Scott Ellis, and on this episode, we are hanging out with Dr. Kraipak, or as she likes to be known, Dr. K. Welcome to the show.
Good morning, Scott. Thank you for having me here today.
It's good to have you here. I've been looking forward to sitting down and having a little chat with you and talking about Plush Dentistry. How are things going for you guys? You've been open for how long now?
We actually opened late October, so it's been a few months, and it's going great. I mean, Frisco is an amazing city to be in, and I think we made the absolutely best decision to open up a practice there.
And it's a beautiful practice, too, by the way. I love what you guys have done in that office.
Thank you.
Yeah, it's very comforting to walk in and just see something that's so nice and clean and just very inviting.
Yes, that's the exact idea, behind Plush. We did not want a practice which looked like a typical dental office. So keeping patient anxiety and comfort in mind was basically the idea behind designing.
Okay. And it is you and your husband are the dentists there, is that correct?
Yes.
Okay. And how many people do you have on staff now?
We have a couple of assistants, a need-based hygienist, and a practice manager.
Okay, very good. So let's talk a little bit about you and your past. How long have you been a practicing dentist?
Well, I graduated in 2011 from University of Pacific Arthur A. Tagoni School of Dentistry with honors.
That's a mouthful.
Yes. And that very year, me and my husband, we both moved to Dallas. And we've been in practice since then.
Okay, so what brought you from the West Coast? We got a lot of California people moving into Frisco, but what brought you guys here?
Yeah, so it's interesting because I never wanted to move from California. I was totally in love with California. Living in San Francisco, I thought that's how every part of the world is. So,
I wish we had some of that terrain here, yeah.
Yes, but job opportunities were definitely better even at that time. And now when I see so many Californians moving here, I feel better.
Good.
Yeah,
Good.
I'm really happy we made that decision long ago.
Well, so are we. We're glad to have you, especially in Frisco, not just in Dallas, but in Frisco proper.
Right.
So how long have you guys been in the Dallas area now?
It's been more than 7 years now.
Okay.
Yeah.
So you've been here long enough to almost just be Texans.
Right.
Yeah.
Right.
That's important. It'll kind of suck you in before you know it. I came here in 2000. Well, actually moved here to Texas in 99 once and for all. Mm-hmm. And I moved from Austin to Dallas in 2001. And I thought I was going to be in Dallas for about 3 to 6 months on a contract. Mm-hmm. And what is it now, 2018?
Right.
Yeah, been here ever since. So that's what's going to happen. We're not going to let you go. So talk about Plush a little bit, though. The business that you guys just started and opened up. What made you want to open this office in particular, Plush, and in Frisco?
Well, I think every dentist has a dream to practice dentistry the way they want. And right from dental school, me and my husband went to the same dental school. So, we would have business classes in dental school where we had these projects of designing our office. So, just that thought and those projects got us so excited, and we could we would look forward to, and we would discuss, how would our practice be. So we literally, we took those projects so seriously. And when I look at Plush, it's almost what, we used to discuss. We always wanted to practice dentistry the way we were taught in our dental school, where, humanistic education and leadership were the core values. So when you look at the name Plush, every letter in the word Plush stands for something. That's how we came up with the name. The P in Plush stands for perfection, which we strive to achieve in every aspect of dentistry. Be it designing the office, delivering care, the materials that we use, the techniques, the technology, or the staff. The L stands for love. We love our profession. We love our office. We love to work as a team, and we love our patients. U stands for unique. So we have tried to incorporate things in our practice which truly make it unique. The S stands for serene. All of us know a dentist's visit can be a bit intimidating. So, we thought, okay, when we go to a spa for, say, a massage, when you enter a spa, just the ambience and just the overall feel that you get, when you enter a spa, relaxes you even before you have actually received the services. So that's what we kept in mind. We have to design an office that would, get rid of that anxiety that you have when you sit in a dental office. in just the patient, lounge. The H stands for humanistic, which is, one of the core values of our dental school, where, we look for the overall welfare of our patient. We are, we consider ourselves as partners in your dental health, and that's what we strive for.
Wow, I never knew that Plush stood for all of that,
Yes.
but it makes total sense now, and I can absolutely see, having visited the office a couple of times, having spoken with both of you, and been a part of that process as you guys were opening up. I can absolutely see how you've incorporated all of those things into the environment, into your practice. It's really cool. I didn't know that, and I bet a lot of other people didn't either.
I actually wrote down these things, like, what do we want? What do we want our mission statement to be? What do we want our core values? And that's how we, came up with this.
Do most dentists go through that kind of a practice? Are they thinking about a mission statement and things like that? I do that in businesses all the time, but...
Well, we did for ours.
Okay, no, that's great.
Yeah.
I'd never heard about someone in dentistry doing that, so that's fantastic. Okay, so let's now talk a little bit about, because you have such a nice space, and it is, I think, unique in terms of dentistry. What would be some of the things that maybe you guys have run into with that are misconceptions or things that people have maybe misunderstood about your mission or what you're doing?
I think when people look at our brand and, office, they get confused. They think we're only a cosmetic dentist practice. We have received patient calls, especially moms asking us, do we see kids? So we are a family dentistry office. We see kids, adults, older individuals. We do all aspects of general dentistry, and we're also passionate about cosmetic dentistry. Dr. Ali loves, cosmetic dentistry. He has taken multiple courses from New York University, on veneers and other cosmetic dentistry stuff. I also love it, and I basically enjoy doing all forms of dentistry. So we do see the entire family. We're also affordable. We see uninsured people too. We have financing available for them. We accept all PPO insurances. We do all aspects of general dentistry, and if we feel that there's something outside our scope, we do work with local specialists which are around the area who we trust, and we're basically like your quarterback. We work with them, closely with them.
Very good.
Yeah.
That kind of, I think, already answered my next question, which is if there's one thing you want people to know about Plush, and I know from our conversations in the past, that is that I think despite maybe the perception of an emphasis on cosmetic dentistry, and I know Dr. Ali lights up when we talk about that, so I know how much he loves that, but you guys really are full service. You do see the whole family. You take care of everybody, and there's a strong family focus on what you're doing as well.
Right.
Yeah. Is there anything else that you think people should know about Plush? Anything in particular?
Well, at Plush, we tailor each appointment to you. So before you step into Plush, we already, we try to, send you patient forms in advance so that we can review everything about you before your appointment. By reviewing, I don't just mean the doctor reviews it, but the staff, so that we can tailor that appointment, based on your needs, your objectives, and your goals, and we know what to expect. When you walk in, we have a consultation where, you have the opportunity, or, we have the opportunity to still know you more, understand you. I want to know about your previous dental experiences. You may have had unpleasant dental experiences, or you may have had normal dental experiences, but I want to know, how can I still make it better? So we believe in individual care. I don't think there's, a one-size-fits-all policy when it comes to dental care. So we're very, very focused in delivering customized patient care, and I think that's where we stand out. We're also big on technology. Now, this is not to intimidate patients, we use laser, so we're going to laser your teeth, and, but we have those facilities, for patient comfort. A lot of people get intimidated by lasers, where soft tissue lasers are literally painless, and they're so fast, and they have instant results. So we have facilities like the Dry Shield where, you basically, it's a 3-in-1 where, it's a bite block, it's a tongue retractor, and an automatic suction. So we don't have assistance, pulling your cheek, retracting your tongue. That little piece does 3 things in one go. So, we can focus on dentistry and you can, be relaxed, and we have noise canceling headphones so that you can just watch TV and it takes your mind away. Now, this is not something that you should, base your dental visit on. These are all distractions to try to make the dentistry or your dental visit as comfortable as possible. We also are big on CE courses. Me and my husband, we attend continuing education courses because dentistry is changing. There is so much technology now that you have to keep up. So we're continuously, taking educational classes, learning new things, because it all comes down to how efficient and skillful you are in the patient's mouth.
So what is the device called that's the 3-in-1 thing? What is that?
It's called the Dry Shield.
The Dry Shield, okay. Yeah, so, that sounds kind of interesting to me because I know that it's been a while, but in dental,
it's been
visits,
a while.
It's been a little too long, actually. Yeah, I'll admit that. You can't see me behind the pop shield, so. But yeah, when you've got like 2 or 3 people trying to, work inside of your mouth, that gets uncomfortable very quickly.
Exactly, and sometimes, what happens is, we work as a dentist, so we have to work in a very dark environment. The mouth is very dark. There's saliva, there's tongue, there are cheeks, and most of the materials that we use have to be placed on the teeth in an absolutely dry environment. So you can imagine how difficult it is, and you're working in millimeters. So, we consciously incorporated that in our practice because it helps us to achieve excellent results in half the time, and we're not, the assistant is not frustrated trying to retract the cheek at certain angles. The patient is not frustrated because, we tell them, okay, try to relax your tongue, but that actually does the exact opposite.
Right.
When you tell somebody to relax the tongue, they're actually focusing more on their tongue. Mm-hmm. And that can just, be so uncomfortable. And when you're constantly, moving the patient's tongue, cheek, and other things, it's very uncomfortable. So what the Dry Shield does is it basically stabilizes the mouth in one position, and it has automatic suction. So it is truly a blessing.
Keeps things nice and dry for you. That way you can get the work done quickly. And
exactly. There's just no contamination because it's suctioning throughout. So the working environment is pretty dry.
See, even just talking about dentistry gets me a little worked up, and I'm starting to relax now, so this is good.
I'm glad, yeah.
I'm actually not afraid of the dentist, but I know that there are people out there who are, so I'm sure that hearing about some of the ways that you're going about trying to make people relax more. I mean, things like noise-canceling headphones are great, but things like the Dry Shield, maybe even more so, because it just takes some of the pressure off of them while you guys are doing your thing.
In fact, after dental visits, this is the number one question that patients ask us. What was that in our mouth? Like, that was such a blessing because we didn't feel anything. The mouth was stable, and when you used other forms of distraction, time just flies away. It's not comfortable to have your mouth open for a long time. I mean, you may have noise canceling headphones and use all forms of distraction, but the mouth is still open, and that's not a normal position for an individual to be in. For
some people it might be, but
yeah, so
they talk a little too much, but
so you have to cut down operating time, and it exactly does that.
Yep. Okay, very good. So you guys are fairly new to Frisco.
Yes.
Frisco is obviously growing very quickly. There's a lot of people moving in. I think other people from California are going to be naturally attracted to you guys because you're from California, assuming that they know that, and hopefully we can help you get the word out about that.
We actually get a lot of patients from California who are looking for a dentist.
But for everybody else that's already in Frisco, maybe they don't have a dentist yet, or if for any reason they're not happy with where they're going, give us a reason or two. Why would I come to Plush? Beyond all the things I've already heard, if I'm going to come check out Plush, why?
Well, I would answer that best by saying, patients can actually come in to see why. We have complimentary consultations, and we can give you a tour of our office and discuss. So like I mentioned, our treatment approach to dentistry is very customized. It's not a one size fits all policy. So I encourage people looking for a dentist or switching their dentist to come in, visit us, and just book a complimentary consultation with us to see if we're the right fit.
Okay, that's a good answer. I like that. There's another thing that I think people should know about that we discussed in our last sit down together, and that was that you guys don't double book.
Oh yes.
Right. And I'm going to let you explain that because you'll do a better job than I would. But I was glad to hear that, and I think a lot of other people would be as well.
Yes. So, I have been practicing dentistry in Dallas for about 7 years, and the thing that would limit me as a dentist was the amount of time that I could spend with my patients. When I have to see 4 or 5 patients in 1 hour, there's only so much I can do. I am a human being first, then a dentist. So, there's only so much so much time I can give each patient. And that as a healthcare professional can be very frustrating, because I don't think that's how healthcare should be delivered. Especially dentistry, because you're doing procedures which are irreversible in the mouth. You need enough time, you need enough focus, and you need the patient to be comfortable. And that is not possible if I am doing 3 or 4 patients in 1 hour.
Yeah.
So at Plush, we are big on booking 1 patient at a time. If you have an appointment with, say, me or Dr. Ali, you have our attention and focus for the length of time that you have booked with us. We're not going to be hopping from one treatment suite to another. You will be, consulting with us. We will be doing your exam. So if you've booked an appointment with us, we are there for you, including the staff. So that's how we can deliver that personalized care that we're so proud of. Otherwise, it's just not possible. I couldn't do it. I mean, I was doing it because I was working for somebody else, but I was always struggling with it. And I just felt, that was just not the way I wanted to do dentistry.
Well, and it speaks volumes toward illustrating the fact that you guys really are focused on the patient and their outcome. Mm-hmm. It's not just lip service. You're not just saying that. This is how we're going about doing that. So
right.
I think people can take some reassurance that is the case.
Right. Even when we were, looking for staff, because, people work in such environments where they're, used to turning around patients so fast and rooms so fast. And so we had to sit down with staff and go over our values and our mission, and the culture that we want to establish at Plush. And we had to actually slow people down and say, hey, there's no need for you to be in rush, because that's that's what they had been doing all these years. So we had to actually slow people down.
Good. Well, we appreciate that. And I one last thing that I think about is I've heard throughout, the years that dentistry, being a dentist, is extremely stressful, that it is a very high stress. And people don't realize how high stress being a dentist is. And it sounds to me like a lot of the things you're doing are also going to help you and Dr. Ali be more relaxed. And if you're more relaxed, clearly your patient care is going to be better and more focused. And it's not only having an environment like that to work in, it's also having the time that you need to spend with the patient. But I've really got to believe that all the things you're doing to help a patient relax helps you relax that much more, because it's got to be stressful for you when a patient is just wound tight and they're not able to relax and kind of let you do what you need to do.
Exactly. And it makes me miserable when I have 4 such patients in one go.
Yeah.
So, like I was mentioning, dentistry is a beautiful profession. We truly have the chance to instantly change people's lives sometimes, but it's also a very, very stressful profession. We work in a mouth which is like I mentioned, it is dark. It is, there's so many things going on, and we literally work in millimeters. We say we're doing fillings, we're actually working in millimeters. There's certain millimeters that the filling has to be. So, you have to be really a perfectionist to do that, and it can get very frustrating if there are so many other factors in your head going on. So, we just wanted to take all that off and just do dentistry, the way we believe it should be delivered.
Well, I'm very excited for you guys, and we're extremely happy to have you in Frisco. So before we go, I'm going to ask you the same question I get to ask everybody. Give us one thing you just love about Frisco. It might be a favorite restaurant or thing to do or just some aspect of the city, but what do you love about Frisco?
I think when we were looking for a spot for our office, we looked at many places. And there was one spot that we had finalized, but that deal didn't go through. And I'm so happy about that because it wouldn't have been Frisco. Frisco is a growing community. It is so diverse, and that's, the diversity is what I love. It is a very family-oriented city, and there's lots of stuff to do in Frisco, especially for families. So, we don't live in Frisco, we live in Allen. But
Okay.
I always, that after opening up our practice here, we often talk about maybe, eventually we should move here because I think the schools are great. Mm-hmm. The houses are beautiful. And with more people moving in, it's very diverse. And I think that would be a lovely environment for my kids to grow in.
Very good. Well, we're glad to have your office in Frisco. Hopefully we'll be able to drag you guys in from Allen before too long as well.
Well, it's just we live 10 minutes from our office, so it's almost like, we're in Frisco.
I hope it stays 10 minutes the way traffic is going in our area.
I know, yeah.
Yeah, we'll see, but I wish you well on that. So, Dr. K, thank you so much for joining us today. It's been great to have you on the podcast.
Thank you, Scott. It was a pleasure being here.
You bet. And for all of you out there listening, thanks again for tuning in. Check us out at lifestylefrisco.com, and we will talk to you next time.
You're listening to RNCN, the digital destination for premium talk radio.